Hi, I am Dr. Gautam Singh from Shri Ram Singh Hospital and Heart Institute, East Delhi, Krishnanagar. So we're going to discuss about hypertension today. Firstly, I would like to tell you about how this hypertension started. It was not up to the late of 16th century that a scientist from Italy found out that this blood has a pressure. This blood that is flowing in the heart has a pressure, and the blood flows across the different valves of the heart. So that is where the whole knowledge of our blood pressure and everything grew. And later many studies in the world were done, and with these studies we found out that the people who have high blood pressure, their life expectancy is low. And the people, when their blood pressure is more towards the normal, or in common language we would say around 120/80, their life expectancy would be more. Now let us talk about the world scenario and in the Indian scenario. It is very alarming that in the last 20 years, the all-cause death because of blood pressure has doubled itself. So you can imagine if in 1990, maybe around 100 people would die because of blood pressure. Now in 2020, we are having more than double. So that means around more than 200 people die because of blood pressure. But now let us see the figures, actual figures of the world. When we talk about, they come into millions. So what we are talking about, in 1990 we had around say 75 million people who died because of blood pressure, and now we have around 150 million people who die every year because of blood pressure. You should also know over here that there are the three major causes of death most common in the world are heart attack, brain stroke and diabetes. And the maximum cause of death in all of these three conditions is because of blood pressure. I would like to bring to your notice that reducing the blood pressure just by 5 mm of mercury of diastolic blood pressure for 5 years would reduce the chance of you getting stroke by 42% and all-cause death by 37%. So can you imagine how important it is when your doctor says that your blood pressure is slightly high and you need to take your medicines in time? What happens is that we think that, oh, we are used to this blood pressure. Whenever we record this blood pressure in our house, it comes high. So that's okay. But it's not okay. So we need to upgrade our medications and we need to reduce our blood pressure so that we have a healthy life and our life expectancy increases. So let me tell you one thing. Whenever we record the blood pressure with the electronic blood pressure machine, what we should do is we should first ensure before buying the machine that the machine is correct for our size of our arm. So there are different kinds of cuffs that are there, that is the small, medium and large, and depending on what the circumference of your arm is, you need to get that kind of a BP cuff for yourself. And there are markings and there are guides on the cuff in which you can see how much your blood pressure cuff should be and how it should be recorded. After you record your blood pressure, for that you should be sitting comfortably, you should be relaxed, it should not be a very cold temperature, you should not consume any alcohol or tobacco or have had a heavy meal just before measuring your blood pressure. So you should be in a comfortable environment, preferably sitting. When you lie down and record your blood pressure, it may come a slightly lower than normal. So have your blood pressure recorded when you're sitting and your arm extended and your BP instrument almost at the level of your chest or at the level of your heart. And your arm should be comfortably extended on the table. And then you should record your blood pressure at least 3 to 5 times and in each arm, and then take the average of that, and that average is your correct blood pressure. That should be there. Let me tell you that sometimes the patient comes to the doctor and the blood pressure is very high, maybe it's around 150/90, and the doctor says that there may be certain reasons because of which your blood pressure is high. You may not require a medicine immediately and you may require to do certain investigation. We recheck your blood pressure, and after rechecking your blood pressure, confirm if it is a high blood pressure, then we can give you certain medication. So dear friends, at the end I would like to conclude with stay healthy, keep your blood pressure in control and take your medications in time. Today, I would like to talk about lifestyle, which is a very important cause and a very effective treatment for hypertension. So in the recent times, we have seen that the way the lifestyle of people have changed. Eating habits have become very unhealthy. Before, getting food would be a challenge. People would go in the jungles and they would hunt for food. But now what happens? You just give a call from your mobile and within 30 minutes, food is delivered at your doorsteps. And mind it, it's not the most healthy food that you're going to eat. Well, the food that we eat, the packed food that we eat, has got very high salt content and very high sugar content. And these things, they cause very bad effect on our heart and on our blood pressure. What happens is ultimately we get obese, we start putting on weight, we become lethargic, we become weak, we don't want to work any longer, and we put on weight, and with this our blood pressure starts increasing and rising. So with this, when the blood pressure starts increasing and rising, this also causes effect on our different organs of our body. It causes effect or bad effect on our heart. It causes bad effect on our kidney, our lungs, our eyes. It causes bad effect on our brains. What can happen? This can lead us to a stroke. This can lead us to a heart attack. This can lead us to a chronic renal disease or a cataract, or it can cause glaucoma to us. So many diseases that can happen because of hypertension, because of bad lifestyle and bad dietary habits. So let us see how we can improve our diet and how we can improve our lifestyle. So there are some healthy tips that I would like to give you at this point of time. Number 1, we should get up in the morning, eat a lot of fresh fruits and vegetables in our diet. We should try to consume maximum amount of fruits and vegetables in our diet and have a very little of carbohydrates which are coming from potato or rice, or protein diet also should be limited. So fruits and vegetables are something that should go more in your diet. The other thing that you should reduce in your diet is packed food. Do you know every packed food that you get is full of salt and is full of these things that causes harmful effect on your body. The other thing that I would like to advise to my young viewers today is that you should eat very slowly and you should eat without looking into a device. I'm sure most of you eat your food either looking in a television or looking at your mobile. Well, what we should do is we should totally avoid that. So we should have our food without looking into a device. After that, we should remember to chew our food slowly. And mind it, let there be a small hunger gaps in the day. So it doesn't need to be that you eat your food in time and you never feel hungry. There should be a small amount of time in the day when you are actually hungry and you would like to eat food. And at that time, eat slowly and eat good food so that your diet remains good. Now let us talk about the physical activity. Doing certain amount of physical activity is also very important. Since our lifestyle is very sedentary now, so doing around 8,000 to 10,000 steps, I'm sure many of you have those fancy Fitbits and you do your steps every day. So doing around 8,000 to 10,000 steps a day would really do a good physical activity for you. If you do your competitions and you increase your physical activity, that would even be better. Reduce on alcohol. Yes, the trend now is coming. Everyone is very cool about alcohol. Alcohol may have now come into our society as a very casual thing. It is there in the families, it is there in relationships, it is a part of every party. But reducing the consumption of alcohol and tobacco in our diet would really keep us much healthier than if we consume them a lot in our diet. Now let us talk about weight loss. Do you know, just by reducing 5 kg of weight for almost 2 years would reduce your chances of getting hypertension or any complications of hypertension by more than 27%. Just 5 kg of weight loss. And just by reducing half a kg of weight of yours, you will reduce your blood pressure by more than 10 millimeter of mercury, just by reducing half kg of weight of yours. So dear friends, losing your weight at this point of time becomes very important. Now let us come to something that is having a good sleep. Having a good nap is very important. If you don't sleep well, your blood pressure is bound to increase, your stress levels are bound to go high, your dietary habits are bound to get spoiled, your exercise schedule is going to totally scrap out. So have a good sleep, sleep for a good 6 to 8 hours. I've heard a lot of patients say that, oh, I'm okay by sleeping for 4 hours, I'm okay sleeping for 6 hours. If Modi can do it, why can't I do it? But well, your body requires more than 6 to 8 hours of sleep, and have a good stable sleep. The bottom line to consider is that having a good lifestyle will reduce your chances of getting hypertension and any complications of hypertension by 50 to 60%. So it's very important for us to have a good lifestyle. And you know, all the doctors would recommend you before starting a medicine for blood pressure is that you make certain changes in your lifestyle, because these are very, very important before even the medicines can act on you. So at the end, I would like to tell you all that have a good lifestyle, sleep well, eat well, exercise well, and stay healthy. Thank you.